Hi, Eileen Veilleux The Fam here. Welcome to a new installment in our mini mental health series. And in this installment, we are going to be covering what is called Cotard delusion disorder, otherwise known as walking corpse syndrome. Um, Let me just clarify the error because of the name. This does not deal with zombieism. There is no such thing as a zombieism. Um, but there is a reason why they call it walking corpse disorder. And I will be going over that with you. Before we start, let me just remind you that pay attention to the video. Please watch the full video because there will be 3 keywords in the video. When I get to the keyword, I will say keyword and what the keyword is. At the end of the video, in the comment section, along with a genuine comment about the video, please put in what the 3 keywords are if you want to be entered into my free merch giveaway when I reach 2,000 subscribers. So let's get started. Okay, Cotard delusion, also known as the walking corpse syndrome or Cotard syndrome, is a rare mental disorder in which the affected person holds the keyword delusional belief that they are already dead, do not exist, or are putrefying, or have lost their blood or internal organs. Now, what is the cause of Cotard syndrome, though? Because this is rare. In addition to Cotard delusions, it seems to occur most often in people who think that their personal characteristics, rather than their environment, cause their behavior. People who believe that their environment causes their behavior are more likely to have a related condition called Capgras syndrome. So what are the symptoms of this rare mental illness? Well, one of the main symptoms of Cotard delusion is keyword nihilism. Nihilism is a belief that nothing has any value or meaning. It can also include the belief that nothing really exists. People with Cotard delusion feel as if they're dead or rotting away. In some cases, they may feel like they've never existed. While some people feel this way about their entire body, others only feel it in regard to specific organs, limbs, or even their soul. Depression is also closely related to Cotard delusion. A 2011 review of existing research about Cotard delusion notes that 89% of documented cases include depression as a symptom. Other symptoms will include anxiety, hallucinations, hypochondria, guilt, and preoccupation with hurting yourself or death. So who gets this rare mental illness? Well, let's find out. Researchers aren't sure what causes Cotard syndrome, but there are a few possible risk factors. Several studies indicate that the average age of people with Cotard delusion is about 50. It can also occur in children and teenagers, though. People under the age of 25 with Cotard delusion tend to also have bipolar depression. Women also seem to be more likely to develop Cotard delusion. In addition, Cotard delusion seems to occur more often in people who think their personal characteristics, rather than their environment, cause their behavior. People who believe that their environment causes their behavior, like we said earlier, are more likely to have a related condition called Capgras syndrome. This syndrome causes people to think that their family and friends have been replaced by imposters. Cotard delusion and Capra syndrome can also appear together. Other mental health conditions that might increase some risk of developing Cotard delusion include bipolar disorder, postpartum depression, catatonia, depersonalization disorder, dissociative disorder, psychotic depression, and schizophrenia. Cotard delusion also seems to be associated with keyword neurological conditions, including brain infections, brain tumors, dementia, epilepsy, migraines, multiple sclerosis, Parkinson's disease, stroke, and traumatic brain injuries. So, in honor of Halloween month, I thought this was a good one. But remember, it is a rare, and I do mean rare. There's not a lot of cases on Cotard delusion. I would say maybe about 1 in every 100,000 or so, something like that. It's a very rare mental illness that some people get, but as you can see, it does affect a lot of areas in the brain. So now that you know what it is, that's why I said it is not a zombie type thing. What happens is people think that they don't exist, so they may stop eating. They may stop caring for themselves with their hygiene. They may look in the mirror and look at their eyes, pull their eyes down. Or when they look in a mirror, they believe that they see a walking corpse when they actually aren't. That's why it's called Cotard delusional syndrome, because they're under the delusion that they're dead when they're not. So that's what this is. Wednesday we will be going over the diagnosis and treatment for Cotard delusion. Remember to put in them 3 keywords that were mentioned in the video to be eligible for my free merch giveaway. And until I see you again, remember, you matter to me. Yes, you. Because you were uniquely made. And I love you for you. So always see with your heart and not your eyes. Because what your eyes see is not important. What truly matters is invisible to the eye. And only the heart can see that. So always see with the heart and not the eyes. And until I see you again, I love you all. Bye.